is from the Journal of Allergy and Clinical Immunology into the record, if that's possible.
Without objection.
Thank you. So you think there are health effects lower than 60. How often do you think that level should be reviewed?
So as I said, the evidence of health effects below a level of 60 parts per billion are not strong. So I don't feel comfortable stating that are definitely health effects below a level of 60 parts per billion based on the evidence.
You believe that science, that the data behind that should be made open to the public?
That data is open to the public.
Okay. You're a medical doctor, is that right? You understand lung disease. Your specialty is
pulmonary and critical care medicine.
Pulmonary and critical care medicine. Mr. or Dr. LaFawn, you're a scientist, you said.
I am, sir.
You am, sir. You did research, and you named a whole bunch of people in your statement. Can you go back over those groups again, who you did the studies for?
Yes. I designed with Dr. Milan Hazuka the Schlegel exposures that were used.
Okay, but you named a whole bunch of groups, tribes and governments.
I'm sorry.
Yeah.
Those are the groups that I've done research for.
You've done research for, so you're a scientist, you're a research scientist. Okay, can you name those groups very quickly? I'm getting before I run low on time here.
Oh, yes. Okay. I have assisted the American Lung Association with the State of Air report that every year.
Just the group.
Okay. The Forest County Potawatomi group in Wisconsin, the U.S. Forest Service, U.S. EPA, Congress was the Office of Technology Assistance, the White House dealing with the National Acid Precipitation.
Okay, that's plenty. Thank you for that. So you're a research scientist. You probably don't know any things about lungs and what'd you call that, doctor? What kind of diseases? Pulmonary?
And critical care?
Critical care. You probably, as a research scientist, Dr. LaFawn, you probably don't know much about that.
I do.
You do?
I do.
So you've been studying that too?
I have.
Good for you. You need to get a TV maybe to use in your spare time. Dr. Rice, you heard Dr. LaFawn's research stats that naturally occurring ozone, as I understood the figures, is somewhere between 40–50% background ozone in some of these areas, which makes up the numbers that we're looking at. Is that accurate, Dr. LaFawn?
In some cases, it's 80 to 90%.
Well, I wasn't going to go that high, but just to say as a general rule, it's 40 to 50%. So you're aware of that, Dr. Rice. You're also aware of, as the gentleman from Oklahoma said, that ozone's going down, but asthma is going up, and you don't know what causes asthma.
You asked me a number of different questions. I'll try to address all.
Well, you're aware of his statistics, I take it.
I am aware of his studies, and I'm aware of other studies that have given other projections of the amount of background ozone. Let me finish, please, and try to answer your question.
My only question was, are you aware?
All right.
Thank you. So you know that ozone is down, asthma is not gone down. Would you agree that if there's more stringent controls put on business, that's going to drive the price up, Dr. Rice, of doing that business?
I'm a physician. That is not what I'm here to talk about. I'm here to talk about
but if they have to add technology to decrease ozone, it's going to cost something.
You also mentioned that I just want to clarify for the record that you said asthma is going up. Again, ozone has nothing my testimony has nothing to do with the asthma prevalence.
But here's what I'm driving to. So we don't know cause and effect. We do know there's a lot of natural occurring background ozone. It's going to drive the cost up. Stringent regulations are going to drive the cost up. And as Mr. Alford said in his remarks, and I happen to agree with it, it's going to cost billions of dollars, lost jobs. That's going to cost money to consumers who cannot afford health care. And so their level of health care is going to go down as a result of this, and we really don't know that it's going to have a positive effect on asthma.
Congressman, I respectfully disagree that we don't know cause and effect. I think the evidence is very clear that ozone exacerbates asthma.
I said cause. I didn't say exact. Cigarette smoking does too. Are you on a kick to do away with cigarettes?
That's a different issue.
Okay, I'm just blowing smoke, aren't I? Okay. I got it. Mr. Chairman.
What do you think I advise my patients?
Okay, I yield back.
Thank you, Mr. Weber. The gentleman from Texas.